Good morning, and thank you for joining us. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, Peel's Medical Officer of Health, Deputy Rob Grimwood from Mississauga Fire and Emergency Services, as well as Carly Farrow, President and CEO of Trillium Health Partners. I first want to wish Mississaugans a very happy New Year. And I also want to send my best wishes to Mississauga's Orthodox, Coptic, and Eastern Catholic communities as they celebrate their Christmases today. Merry Christmas. Like all of you, I remain hopeful that 2022 will be a much brighter year for us. The holidays were certainly not what we were hoping for. We saw Omicron pick up speed and spread quickly across the entire province. Many people had to scale back or reschedule gatherings or isolate from family and friends because they contracted COVID, including me, as I tested positive just before Christmas. It was incredibly tough being away from my family, from my kids and my 85-year-old mother, Veronica, over the Christmas season and New Year's as well. And I feel for everyone who has faced a similar situation. I want to thank the people of Mississauga and my colleagues for their well wishes and the outpouring of generosity, which greatly helped me on my road to recovery. The reality is that while the holidays were tough on so many of us, we're not yet at the peak of Omicron. As you will hear from Dr. Lowe in just a few moments, much like other countries who have already been through the worst of it, we will experience a flash flood of cases in the weeks to come. This is because the variant is so transmissible. It's spreading far and wide more quickly, which means that more of us will contract Omicron or know someone who has. But the good news is that when the flood dissipates and the skies clear, brighter days are most certainly ahead. As many of you know, new province-wide restrictions came into effect on Wednesday to deal with this surge of cases, including reducing gathering and capacity limits in certain settings and a pause on indoor dining, gyms, and recreational activities, and a return to virtual learning for students until at least January 17th. I know that the people of Mississauga are feeling anxious, tired, angry, and disappointed that once again they're being asked to put their day-to-day lives on hold. Whether it's our business owners who have had to scale back their operations, their employees who are now out of work, parents who have had to juggle work while caring for their children, and school-aged children who were looking forward to getting back to class with their friends but can't right now. This is not where we imagined ourselves in 2022. That being said, if we're going to make it past this flash flood as soon as possible, we need to work together to keep our city healthy and protect the capacity at our hospitals. Even though only a small percentage of people who contract Omicron, about 1 in 100, will end up in the hospital. Case counts are so high right now, it has put our healthcare system in an extremely precarious situation. Here in Mississauga, Trillium Health Partners currently has 87 patients being treated for COVID and 15 in the ICU. But like so many other hospitals, it is also staff shortages due to illness and exposure that is compounding the issue and making it more challenging to deliver the health care our residents rely on. The fear is that without these new provincial restrictions, we would see further increase in COVID hospitalizations and even more staff shortages, completely overwhelming an already embattled system. We need to preserve hospital capacity, not only to care for new COVID patients, but others who may need life-saving care over the next few weeks. Those injured in a car accident or in the workplace, or someone suffering a heart attack or stroke. While we focus our efforts on COVID, we need to work together to ensure we don't leave others behind. And now I'll turn it over to Carly Farrow to speak about the current challenges facing Trillium Health Partners. Carly, over to you.
Thank you very much, Madam Mayor, and thank you for the support of you and all of the community as we face this Omicron wave. I want to acknowledge as well our health system partners, and of course, as you've referenced, our frontline caregivers who are now facing yet another wave, and many who are off sick with COVID-19 themselves. So as the mayor said, Omicron is different than past waves. And thankfully, we have a high rate of vaccination in the community, which is helping us ensure that not as many people are going to the ICU. As the mayor mentioned, we at Trillium Health Partners right now are caring for 87 people who require hospital care for the COVID-19 effects that they are feeling. But overall, at Trillium Health Partners, we have 200 people who are in the hospital who have COVID-19. So the remainder of those people are receiving care for something other than the virus, but they do have the virus, which can impact their care and can impact how long they stay in our hospital. This is especially true for people who are not vaccinated and for people who are elderly and vulnerable with frail conditions. We are seeing that hospitalizations continue to increase overall. And as I mentioned, with the high number of COVID-19 cases within our hospital, we have a more infectious disease overall. So just to give you some context, 7 days ago, about 9% of people at Trillium Health Partners receiving hospital care had COVID-19. But today that number is 16%. So 16% of all people who are receiving care at Trillium Health Partners have COVID-19. We expect this number will increase as we see COVID-19 increase in the community. About half of the people admitted to the hospital have received at least 2 doses of the vaccine. That is why our critical care numbers are at the level that the mayor described, 15. In previous waves, that number would have been twice as high. So at the hospital, we are very focused on preventing the spread of the virus within our walls because there are so many more people with COVID-19. In order to do that, we've had to make the difficult decision to allow only essential caregivers to visit loved ones in the hospital. That decision did not come lightly, but it is intended to protect the safety of our people that are providing care, and most importantly, our patients who are receiving it. We have placed teams across the hospital to ensure the proper use of PPE, safe distancing, and excellent infection prevention and prevention control practices. As the mayor mentioned, we are focused on preserving all hospital capacity at this time for a surge in cases that continues, and we do not believe we've reached the peak. We have now reduced all surgeries and procedures that are not urgent or emergent. And we have asked the community not to come to the emergency department to receive a COVID-19 test. This is in line with the messages that you have heard from our medical officer of health and the chief medical officer of health of the province. As the mayor mentioned, part of the pressure that we are experiencing is the significant number of staff and physicians who have contracted COVID-19. So we have 350 people off due to COVID-19 as of yesterday, and that number continues to increase. To proactively address this, we have already redeployed approximately 150 staff from other areas of the hospital, including places like surgery. These are difficult decisions to make, but ones that we have made to protect the safety of our hospital. We are also working with regional partners, as we have done in previous waves, to ensure that the entire healthcare system can protect the integrity of hospital services that everyone depends on, including the people of Mississauga. Finally, at Trillium Health Partners, we are continuing to contribute to the regional effort to vaccinate people. As I have said, The vaccine is the greatest protection we have to prevent severe illnesses, and we continue to see that in the Omicron wave. We have a vaccine clinic that delivers over 1,000 shots a day because we know that is the best protection. So for all people in the community, the best way that you can support your hospital right now is to get your COVID-19 vaccine. Thank you for all of your support.
It's not just our hospitals that are seeing staff shortages because of Omicron. It's a problem experienced by workplaces across the province, and the situation is changing daily. I do want to assure the residents of the City of Mississauga that we are in a very stable position and continue to deliver the critical and essential services which you, our residents, rely on. We have a business continuity plan that allows us to prioritize and maintain essential and critical services, even if staff shortages were to get as high as 40%. While we hope we never get to that point, we are ready to scale up or scale down operations across the organization based on current available staff and redeploy staff from non-essential roles into essential roles if needed. At this time, we are seeing some service impacts in our transit system. Starting today, MyWay has temporarily suspended service on routes 101 and 101A Dundas Express and the 107 Malton Express, as well as reducing service frequency on route 103 Hurontario Express. Our MyWay team will continue to work to deliver our residents with the most reliable service where it's needed the most. And when it comes to our critical services here in Peel, our paramedics have had to put their new measures in place to deal with staff shortages. Policing operations have not been impacted, and resources have been redeployed to ensure coverage right across Peel region. Mississauga Fire and Emergency Services continue to maintain their current service levels and have a contingency plan in place to deal with potential staff shortages. This includes pausing some training during critical times and strategically separating technical crews to ensure we have staff with specialized skills to provide critical service to residents. I want to assure residents that all things considered, our city and our frontline emergency services are ready and available to respond when you need them. That being said, they need our help to reduce non-emergency pressure on the system. So we ask that you only call 911 if you are experiencing an urgent, and I mean urgent, medical or fire emergency. I want to thank all our frontline workers, our healthcare staff, firefighters, police, paramedics, and our essential workers, including our transit drivers, winter maintenance, and forestry staff, who continue to put on their uniform and go to work every day to support the people of Mississauga. You truly are heroes. The harsh reality is that we won't know for a few weeks just how much pressure this wave is going to put on all of us. But I strongly believe that there are a few key actions the government can take to get us through this wave faster and protect all Ontarians in the long term. We learned yesterday that the Ontario government procured 65 million rapid tests in December and January, and the federal government has committed to delivering another 54 million tests to the province. This is great news, and I want to thank the Premier and the Prime Minister for making this a priority. Given the new guidance, the current supply of rapid tests will be prioritized for healthcare in congregate settings, and rightly so. But we know there is a huge need and demand for tests from residents all across Ontario. As we navigate uncertainty during this time of transition, we need all levels of government to work together and invest in procuring a reliable supply of tests in the weeks and the months to come. And when the time comes to distribute new shipments on a mass scale, We need to find innovative, accessible, and practical ways to get them into the hands of residents. We simply can't have hundreds and hundreds of people lining up at a mall or in cars only to leave empty-handed. Individuals also have the power to help protect our hospitals, help get businesses back up and running to full capacity, and ensure children can return to in-class learning on January 17th. We all have a role to play in keeping our city healthy and safe. The most important thing you can do right now is get your first, second, or booster dose if you are eligible. Walk-ins for first and second dose, or anyone 5 years of age and older, are available at both of our fixed clinics at the Sheridan Centre and the Region of Peel's Mississauga office. It's as easy as just showing up. Appointments are necessary for boosters, so I strongly recommend that those who are 50 years of age and older access appointments as soon as they are available. I know that the demand is significant. Peel Public Health has opened up 300,000 booster appointments over the past few weeks, with more coming online every day. Trillium Health Partners has also relaunched their clinic, and Peel Public Health is also looking to launch another mass clinic in Mississauga in the coming weeks. I encourage all residents, especially those who are older than 50, to please book your booster shot on the provincial online booking system or through Trillium Health Partners website. We also have numerous pop-up and school clinics that are offering first and second doses to children 12 plus, and first doses to 5 to 11-year-olds. I know that many parents are struggling right now to keep their heads above water, but please make it a priority to get your kids their needed shots over the next few weeks. The best thing you can do to help ensure that when schools reopen, they stay open. I do want to thank the Ontario government, and especially Education Minister Stephen Lecce, for listening to our calls and prioritizing education and childcare workers for their booster shots. With the province's mass vaccination site at the International Centre in Mississauga now providing priority third dose bookings for education staff, our educators, including our teachers, school bus drivers, and custodial, administrative, and childcare staff in the evening hours. For a lot of people, the pause on indoor recreational activity has been the most difficult. I know how critical it is to physical and mental health, and I realize that the next few weeks are going to be difficult for many. In the light of closures of our indoor recreational amenities, such as our fitness centers, courts, pools, arenas, and gyms here at the city, we're doing everything we can to provide residents with fun and accessible outdoor recreation options. Our tennis, pickleball, box soccer, and multi-use sports courts are all open, as well as our outdoor fitness equipment. Please make use of our leash-free zones, our playgrounds, and toboggan hills. The vast majority of our more than 300 kilometers of trails and cycling trails have received winter maintenance, so I encourage you to get out there for a hike or a bike ride. Celebration Square and Woodhurst Heights rinks are open each and every day, as well as our 43 natural ice rinks across the city. The city is also offering virtual fitness classes online in both live and pre-recorded formats. I encourage all of you to take advantage of these amenities and services for both your physical and mental health. I now want to speak directly to our business community, in particular our restaurant and gym owners. I know there's nothing I can say right now to alleviate your frustrations and the financial burden that this has placed on you and your families. You have continued to pay an incredibly high price as we inch closer to the 2-year mark of the pandemic. As many as have many others of our small business owners. And I ask that all Mississaugans support our local businesses in any way you can, from ordering takeout or picking up, making a concerted effort to stop at our local retailers. Now more than ever, they need your support. I've asked Mississauga residents many times to be resilient and to stay positive. I know this is a lot to ask, but we're in this situation now, and we must work together to get out of it. I want our small business owners, especially those hardest hit, including those in our hospitality and personal care and health industries, to know that I stand with them. I'm asking all Mississaugans to please continue to do their part to limit the spread by booking your first, second, or booster dose and limiting indoor unmasked contact with those outside your household. And now I'd like to invite Dr. Lowe up to please give his update. Dr. Lowe, over to you.
Thank you, Madam Mayor, and good morning. We are now seeing widespread community transmission of Omicron in Mississauga. The recently announced provincial measures represent a prudent and cautious approach to blunt the surge and protect our hospitals, who, as Carly Farrow mentioned, are now contending with increasing emissions coupled with staffing challenges. I want to be very clear that the most recent measures, most of which I understand the reasoning for, are coming in at a vastly different context from the previous. We are very fortunate that in Mississauga and in Peel, so many of our residents have received 2 doses of vaccination, and this has been our absolute saving grace to date. But we also have a large absolute number of adults who remain unvaccinated and at risk of severe outcomes, and we also have a new variant, the Omicron variant, which can impact vaccine protection against infection to a large degree, and to a lesser degree, protection against severity, especially amongst our residents who are older. So I really want to thank all of our residents at this time for their efforts and sacrifices in facing this Omicron surge. It's also why my advice to residents at this juncture is to ensure that their vaccination status is up to date. We are now in a transition period, and we are shifting our focus towards preventing severity rather than the infection itself. It's thus crucial to get protected as quickly as possible through vaccination. Given how quickly Omicron is spreading, you want to be able to face any infection with the best protection that you can get, and that is a vaccine. 2 doses are a good base, and 3 doses are better, especially if you're older. Said another way more clearly, if you choose to remain unvaccinated at this time, you remain at the highest risk for severe outcomes, including hospitalization and ICU, at a time where our hospitals can ill afford additional care demands. If you are an unvaccinated adult, you are going to become part of the Omicron wave that is threatening our hospitals. So I urge you to please stay home, limit your contact in the community to the most essential reasons, and please get your first 2 doses without delay to get protected. I also want to urge our parents of children aged 5 to 11. Now is the time to get your children vaccinated as soon as possible. Peel continues to vaccinate this group steadily, and we have now vaccinated over 35% of our children aged 5 to 11. It's taking our community a little bit more time because we have more children proportionately aged 5 to 11 than most other large jurisdictions in Ontario, which reflects our younger, family-oriented community. So parents, we need your help to please come and get your children protected with their shots so that you and your school community can have peace of mind when in-person learning resumes. We accept walk-ins for children at any of our 5 large public health clinics. No appointments are needed for our littlest residents. For all our residents, I urge you to otherwise visit peelregion.ca/COVID-19 vaccine for information on how to access all of our clinic offerings. I particularly encourage residents aged 50 and over to book today at booster clinics that are being specifically reserved for this age group. Beyond vaccination, I also encourage everyone to reduce risk by sticking to the revised provincial precautions during this Omicron surge. If you or someone you live with is sick, please use the provincial screening tool to determine if you might have COVID. If necessary, you should stay home for 5 days if you're vaccinated or under the age of 12, 10 if you're unvaccinated. Please note that as Omicron activity is widespread in our community, you do not need a test to confirm the diagnosis. Also, this advice does not apply to our highest risk healthcare workers who should review the updated provincial guidance with their employers. Please ensure that your symptoms are improving before breaking isolation, and please do not hesitate to access care if your symptoms are becoming more severe. And for the moment, it's also important for all our residents during this surge to continue to limit gathering sizes, meet and work remotely where possible, and wear a mask indoors and in crowds during this time of transition. The next few weeks will be difficult, but I want to reassure residents that this is very much the storm before the calm. As we transition, I am grateful for the collective efforts of our community to remain protected against severe disease through vaccination and precautions. Thank you for continuing to step up. I'll pass things back to Mayor Crombie.
Thank you very much, Dr. Lowe. And now, along with Dr. Lowe, Carly Farrow, and also Deputy Fire Chief Rob Grimwood, we are all here and able to take questions from the media.
Our first question is from Miriam from Radio Canada, and this question is for Dr. Lowe.
Very good.
Go ahead, Miriam.
Dr. Lowe, over to you.
Hello, hi everyone. Bonjour, Monsieur Dr. Lowe. Pensez-vous que c'est encore réaliste de viser une réouverture des écoles le 17 janvier en Ontario?
Oui, merci pour la question, Myriam. Je veux dire que c'est très important de raconter que les écoles sont un service essentiel. Nous savons que c'est très important pour le développement et l'éducation que des étudiants peuvent être faire rentrer dans le plus vite temps possible. Et nous aussi savons qu'il y a des autres mesures qui étaient en train d'être en place par le ministère de l'Éducation pour donner plus de sécurité dans ce lieu. Mais nous aussi savons qu'avant le COVID-19, le risque d'avoir un syndrome respiratoire n'était pas zéro dans ces lieux. Et il y a un compte entre les deux risques de les écoles dehors, les écoliers dehors de l'école, et aussi le risque de COVID-19 qui doit être calculé. Thank you very much, Miriam, for the question. We know that schools are an essential part of children's education. We know as well that the best place for them to be is in school for their development, for their education. And for this reason, I know that the Ministry of Education is working to put measures in place to continue to ensure that this becomes, this setting remains, welcoming as possible to ensure that students can get back in the shortest time away from in-person learning. However, we do know even before COVID-19 that the risk of developing a respiratory syndrome in these settings was not zero. And I think we really are getting to a point, especially in our current situation, where you have a community that is highly vaccinated and a lot of other measures that have put into place, where you really do need to start weighing the overall risk between the risks of having students out of schools altogether and also the risks of COVID-19 in this setting, and really ensuring that students can make sure that they're optimally served by our school settings. Thanks so much for the question. Merci beaucoup pour la question.
Miriam, did you have a follow-up?
As you know, there will be I'll ask it in English, but feel free to do it to answer in both languages. There will be a vaccination center for school workers, for daycare workers that will be organized in Mississauga. What can you tell us about this new clinic, and how much people do you expect to have?
Je sais qu'il y a une clinique, des autres opportunités pour le staff du système d'éducation de prendre leur vaccination à la Centre international. Ça, c'est une clinique de la ministère de Santé avec des partenaires. et je suis heureux d'avoir cette clinique dans la région de Peel parce que on va protéger des staffs de notre communauté à cette clinique. Mais je pense que le plus important est de continuer avec la priorité pour l'autre protection dans les soins de longue durée et aussi pour des personnes qui ont 50 ans en parallèle avec cette campagne aussi. I think this is a service that's being provided by the Ministry of Health with their partners, and I'm really grateful for it because it is going to help to get educators vaccinated in the region of Peel and protect those staff in our region. However, we are also continuing to prioritize those at severe outcomes, particularly our residents in long-term care, as well as those 50 over through all of our vaccination offerings in the midst of this Omicron surge. Thank you very much for the question. Merci beaucoup pour la question.
Our next question is from Declan at Mississauga News. Go ahead, Declan.
Welcome, Declan.
Good morning, Mayor Crombie. How are you?
Morning.
Glad to see you're feeling better.
Yes, thank you very much. Feeling much better.
How many My Way drivers are currently sidelined by COVID, and do you expect further temporary route cancellations moving forward?
So I will say generally in the city of Mississauga, our situation is very stable. In fact, in checking yesterday and this morning, we aren't experiencing any more staff shortages than we were at this time last year. With respect specifically to My Way alone is not experiencing staff shortages as it's happening across the province of Ontario, but we recognize that there have been some service removal and some service delays, and there have been some trip cancellations that will disrupt travel for some of our customers. There have been some service adjustments, as I mentioned earlier, and we'll be communicating that through our My Way channels, the various communication channels that we use. And we're committed to providing, of course, a safe and reliable transit system that our residents can rely on for essential services ongoing throughout the pandemic. And we remain committed to monitoring all routes in the transit network so that with all available resources and allocate in the most effective way possible. So I can't give you any specific numbers, Declan, if you're asking me. Of course, that changes day to day, depending on how many people have COVID themselves or isolating because maybe someone in their household is, and that changes pretty much day to day. But the situation is stable, as I mentioned. We have suspended routes on suspended the 101 and the 101A, Dundas Express, and the 107 Malton Express, as well as reducing the frequency on the Route 103, which is, of course, the Huron-Ontario Express, and that was in direct response to our transit operators' staff shortages due to either having COVID themselves or self-isolating because of a family member. Hope that helps.
Follow-up, Declan?
Yes, for Carly Farrell, please.
Certainly. Carly, over to you.
Hi there.
Hi, Carly. Good morning. I'm just wondering what percentage of Trillium staff has 2 doses of vaccine, and what percentage of staff has the 3 doses? And also, if I could clarify, of the 350 staff off due to COVID-19, again, sorry, you may have said this already. That includes doctors, nurses, all different staff.
Yes, thank you, Declan. So in terms of your last question, that does include all of our physicians and nurses, allied health, et cetera. And that number, we will continue to update the community. In terms of vaccination levels, Trillium has approximately half of our staff have received their 3rd dose at this time, based on our best records. Many people received their 3rd dose in the community. And so we're just making sure that our numbers are up to date across all units, but about half had their 3rd dose. Our entire organization is vaccinated due to the mandatory vaccination policy we implemented.
Yeah. Our next question.
Yes.
Yeah, our next question is from Jessica from Mississauga News. Go ahead, Jessica.
Welcome, Jessica. Very sorry to hear about Steve Cornwall. Please extend my best wishes to him.
Hi there, this is Jessica. Sorry, I was unmuted.
Yeah, Jessica, please extend our best wishes to Steve Cornwall if you can.
Thank you, I will.
Thanks.
I just have a question about your rapid test that you said will be given to high congregate settings and also people who are in most need. What do you mean by high congregate settings?
High congregate settings are long-term care centers or anyone living in a group setting. So perhaps, Dr. Lowe, do you want to take it over and speak to because there's been change in policy in rapid testing and the guidance. It has come down from the provincial table. And so maybe Dr. Lowe wants to speak to, this has always been an evolving matter. So Dr. Lowe, over to you to talk about rapid testing and who are the priorities for rapid testing today.
Thanks so much, Madam Mayor. No, you have it correct. So it is long-term care and high-risk congregate settings. So certainly high-risk congregate settings, Jessica, that would include things like shelters or adult support service, adult supported living, those sort of settings, as well as congregate apartment buildings with lots of seniors. The reality, as I said, though, is we have widespread Omicron transmission at this point in time. So really, while rapid tests are certainly important, especially in those high-risk settings, more broadly in the community, their utility is rapidly diminishing. When you have a forest that's entirely on fire, it's less important to figure out which tree is on fire and really to try to protect those higher risk settings, the higher risk settlements that might be within that area. And that's what's at least being contemplated with those tests at this point in time, certainly by our provincial partners who oversee the testing program. Thanks so much for the question.
Jessica, do you have a follow-up?
You. I do have a follow-up. Children were given rapid tests when they went to schools. I'm just wondering when they return back to schools, when they do, will they be also given rapid tests at that time?
I'm not sure who you're addressing the question to, but I'll take a shot and then maybe Dr. Lowe wants to add. So we understand, of course, that we're very hopeful that children will return to in-class learning on January 17th. And we also know that that time aligns with the time frame that the provincial and the federal government will make more rapid tests available to us. As you know, they've procured millions and millions of RATs. So I'm very hopeful that they will be sending more tests home with students once they return back to in-class learning. Dr. Lowe, would you like to respond to that as well?
Yeah, thanks so much, Madam Mayor, for the question. And Jessica, our understanding is the Ministry of Education is looking at how they can make more rapid tests available to the school community. So I would encourage you to direct your question to them. Thanks so much.
Thank you.
Our next question is from Natasha from The Pointer. Go ahead, Natasha.
Good morning, everyone. My first question is for Dr. Lowe and possibly Carly, if she wants to jump in. I was just kind of wondering, do we have any indication of how long people are staying within hospital? And can we also please define what hospitalization is? Because I'm hearing a lot of different kinds of numbers for different kinds of definitions.
Why don't we kick that off to Carly, because I know she's probably...
Carly would be best.
Yeah,
please.
Carly be basking.
Great, thank you for the question. So first, with respect to length of stay, we do see the length of stay for people who are admitted not to the critical care units, but the majority of our patients now, as I've said, are admitted to our medicine units. We have not seen a drastic change in the length of stay. So we see length of stay of approximately 5 to 6 days. Primarily that's for two reasons. One, people who are being hospitalized and require treatment for severe illness for COVID-19 are often either unvaccinated or they are frail and elderly. And so that is contributing to their length of stay. In terms of hospitalization, the way we define it is people who attend to the hospital and are admitted for care. You may be hearing numbers related to people who are assessed at COVID-19 assessment centers, but the numbers that we use in terms of the number I described of 200 people overall who are admitted to the hospital right now. They are in a hospital bed who have COVID-19. And of those, 87 have been admitted because they require care specifically for COVID-19. I hope that helps.
Oh, it does. Thank you very much. My next question will be for Mayor Crombie.
Yep, I'm right here, Natasha.
I just want to go back off of what Declan was asking about with MeWay. I know that, or My Way. Oh my gosh.
Yeah, that's okay. You're cute.
I am new. I did notice that obviously you're not saying exactly the number of staff. I'm wondering if this will be a transparency thing later on if we have like mass amounts. Is that something the city is looking at in terms of fire, My Way, and paramedics?
Yeah, obviously, yes. Certainly, we're constantly monitoring the situation. It's in flux as well, but I will say that it's very stable, and we do have a comprehensive business continuity plan in place that, will help us overlap should we need to scale up or scale back down, and that is in every service area, Natasha, not just in My Way, but all our service areas, as I mentioned earlier, fire and emergency services, forestry, recreation, everywhere, to offset each other. But with My Way in particular, we continue to monitor daily staff shortages, and service will have to be adjusted or and will be restored once the employee numbers return to a more stable level. So this is a situation that is being constantly monitored, and we're just making adjustments as we go along. And with respect to transparency, of course, we will always publicize, the names and the numbers of routes that have had to be adjusted. But with respect to the staffing numbers, those do change almost daily, Natasha.
Our next question is from Khaled from My Second Home TV. Go ahead, Khaled.
Thank you, Madam Mayor. Welcome back.
Thank you so much.
You're welcome. Can you please share with us how severe and how did you cope with your illness with COVID? Especially, this will be a first-hand experience. And also, what did you have medications to counter this? And why shouldn't anyone get it?
Oh, thank you very much. I'm very happy to share my personal experience. Of course, I became exposed in the community, and you're never quite sure when, but that may have been in and around the 20th, that you're never quite sure. And I was still testing negative up until Wednesday, and then on Thursday, I started testing positive. And I will share that I am double vaccinated, as you know, and also have been boosted. So my symptoms were very mild. You can hear the congestion in my voice still. I was congested, mildly congested, but I will say that I was very much fatigued. And it was the fatigue in particular that I found very draining. I will say that the spirit of the community shone bright as people came by with prepared meals and soup and all kinds of remedies, as well as vitamins. And I was put on a course of vitamins, of different variety of vitamins, C, D, zinc, etc. And so just pretty much focused on getting rest, taking vitamins and drinking warm liquids. And I began testing I stopped testing positive. I started testing negative on day 11. So for me, it was the full 10 days that that were required for me to feel myself again. And this is now day 16 for me. So you can still hear the congestion lasts for this amount of time, with some people notwithstanding. So I'm very grateful to have the benefit of the vaccine to help me fight this virus. And I encourage everyone, if you're going to get the virus and want mild symptoms, then please be sure you're vaccinated. Go out and get vaccinated. And I did not have to receive any hospital care. I stayed home and rested and isolated. And I would like to share with you as well that my R factor is 0. I infected no one, and I'm very proud of that too.
Great, thank you. My follow-up for Carly, please.
Yes, certainly. Carly, back to you.
Thank you. I want to know if you had to fire anybody from your workforce due to unvaccination.
Thank you for your question. Trillium Health Partners implemented a mandatory vaccination policy earlier this fall in 2021 because we believed it was the best way for us to protect the people who are receiving care at Trillium, and most importantly, ensuring that our workforce was healthy. We had a very small number of terminations that were completed, a very small overall number. Trillium Health Partners has over 12,000 staff, physicians, and volunteers. And the number that decided not to comply with our mandatory vaccination policy was very low, and less than 1%. So we feel very strongly that that was the right policy to implement. And many of our staff had been asking about, what the overall vaccination policy would be for the organization, because the large majority of our people wanted to ensure that we were all in an environment where people were fully vaccinated and doing all they could to protect themselves and the hospital.
Thank you.
Thank you, Khaled. Are there any more questions?
That was the final question for today.
Thank you all for joining us.